Good morning. I will to present the 3 years outcomes follow-up of the prospective study, single arms, with the virtual quadratic male. This trial was made in 14 urological departments in Europe in terms of efficacy and safety follow-up. We had recruited 117 patients with urinary incontinence at least 6 months after radical prostatectomy. The main objective, the first objective, was to try to find the success defined as more than 15% decrease in 24-hour pathway test. The second objective was to find the patient improving using questionnaire, and during the trial, we also got data about QMAS and post-void residual urine and adverse events. After 36 months of the surgery, 49 patients were dry with a pathway test less than 8 grams. Objective and subjective results improvement was 72% and 69% respectively, and satisfaction, the patient satisfaction was achieved in 69% of the patient. No significant degradation of parameters from 3 to 36 month follow-up were found, and no difference with subgraph per baseline incontinence severity, pad usage, and body mass index were found. No significant change on Qmax and post-void residual urine were reported, and the main postoperative complications were perineal discomfort or pain, 9 patients requiring specific analgesic treatment, but only 1 sling revision. Other complications were transient urinary irritation, genital, transient tactile disorder, and urgency. To conclude, this is the first trial with virtuous male slim made in Europe. The effect remained during 3 years follow-up. The primary analysis showed no difference according to incontinence severity and body mass index, and the complication rate was similar to the literature. Due to the diversity of cure or continent patient definition on 24-hour pathway test in the literature, made the comparison very, very difficult. So we need a consensual definition quickly. And we need long-term follow-up, at least for 5 years, for confirm these promising results. And future investigation will be able to affirm the good results in patients with moderate or severe incontinence and overweight, and may justify the use of the virtuous sling as first line of treatment before artificial urinary sphincter in this patient. Thank you very much.
Any questions? What is the difference between the virtuous sling and the advanced XP?
The virtual quadratic slim have 4 arms, 2 prepubic and 2 transobturator. And you can recollocate the urethra and make a pressure over the urethra.
Max?
We see a couple of patients after slings where we have to put in sphincters. This is normal. I think this is okay. There's nothing wrong with the sling when you... But with the Virtue, I would believe that it is much more difficult than after any other sling because of the quadratic shape, and it covers the urethra over a few centimeters. So I would think that's more difficult. Do you have this experience?
Yes, it's not difficult.
Not difficult?
No.
Okay.
No, because the mesh is a hard mesh. It's a hard mesh, and it's very easy put out this if you need after an sphincter.
So the mesh does not stay on the urethra when
No.
you cut it away? Okay.
Most of patients have improved 50%, but the patient's happy, just improving 51 or 55% is enough.
69% is not enough. Enough is 100 per 100. No?
But you see in your results
Yes,
about
but the
only
result-
30% have
Yes,
one
but-
pad.
In patients with moderate or severe incontinence, normal is put an artificial urinary sphincter. But this technique have 40% of complication in middle time. This surgery is easier, is less with less complication. And if you talk before with the patient and explain overall with patient with a big tummy, for instance, you talk with the patient, explain good the technique, explain the less complication than a sphincter, they can choose.
Yeah, I agree with you. It's not that difficult to remove the mesh because you can find it easier than compared to the other. And you just cut onto the mesh and then remove it. I'm not sure that I agree that I would offer this procedure to patients with very severe incontinence because the result is for any sling with severe incontinence, it's bad. Now, if the patient really has poor dexterity, cannot use, doesn't want to have like an active device, he can choose this, but at this point he can choose like a bulking agent, which has like similar results. You can just retop it, no?
Yeah.
So what is your comment on when are you using KUS versus this in patients with severe incontinence?
This is functional urology. You need to talk to the patient a lot and explain that you need to see the hand, his hand. His necessity is different, and for instance, an old man who is in an institution, haven't got an active life or something like. And if you reduce for 5 pads to 1 or 2 pads a day, he may be to be happy with that. It's my opinion.
Emmanuel Charté-Casser from Paris. I'm always confused when we say that it may be or not be efficient for severe incontinence because all patients suffering severe incontinence are excluded within the inclusion criteria of all studies with slings. So we cannot speak about severe incontinent patients and if it's efficient or not for slings because we exclude them. I was part of the study, so it's not discussing the inclusion criteria of the study, but just as we discuss if it may be efficient, any sling in males for severe incontinence, we cannot say it. We have no patients included in the study.
Yeah.
Okay, thanks very much. We have to continue. Presentation 282. Urologic